So now the next step is we're going to take the tip apart. I would only do this if we need to lift the tip up. So we're going to take the two cartilages and separate them. Maybe you can grab that one for me, thanks. So Debbie's grabbing one, I'm grabbing the other, and we're going to go right down the middle with the soft tissues that are connecting them, and we're going to separate those. So we're basically taking the tip apart, and then we're going to put it back together in a position that we prefer. So in her case, it's going to be rotated up and deprojected a little bit. Okay, so that's pretty good. And then, I don't know if you can see this on camera, but the very front here, do you think you can see that? That's actually her nasal septum right there. Now what I'm going to do is just have a look at, just open your mouth for a second there, Ola. I want to see where your teeth sit. Yeah, so your septum at the front seems to be fairly midline, so that's good. So I'm just going to really gently make an incision on the lining of her septum. Good. I'll take a cotton knife, thanks.
This is way better than I thought.
Yeah, you're not really feeling anything.
No.
Yeah. So, you know, it probably looks horrendous on camera.
Can't wait to see it.
But you don't really feel this.
No.
Yeah. So again, you know, on camera, I'm not sure what you appreciate, but if you notice the color of her septum is fairly pale, so it's sort of whitish. And I'm basically just lifting this, you know, it's essentially, it's like skin, but there's a lining that sits on top of that, and we're just going to lift that off so that she's got exposed cartilage. And once the cartilage is exposed, then it allows me to use it to reposition these cartilages. So what I've done is I've taken her tip cartilages that were, you know, together, little soft tissues holding them together. I've taken those apart, so now I can do what I want to do with these. And what I'm going to do with them is I'm going to tilt them up and also sit them down, because she doesn't want them projecting too far forward.